Labdien, visi klātesošie! Paldies, ka pieslēdzāties mūsu šodienas webināram sarunai par pētījumu un pētījumu datiem par situāciju darba vidē Latvijā. Latvija starp Eiropas Savienības dalību valstīm ir valsts ar vienu no augstākajiem letālo un smago darbā notikušo nelaimes gadījumu rādītājiem. Tomēr citās jomās situācija ir labāka un Latvija nav starp sliktākajām Eiropas Savienības dalību valstīm. Kuras ir šīs jomas un kāda ir situācija Latvijā salīdzinājumā ar vidējo situāciju Eiropas Savienībā, kā arī Lietuvu un Igauniju, ar ko mums ļoti patīk salīdzināties? Par to šodienas seminārā dalīsimies ar ESENER pētījumu datiem. ESENER pētījums ir Eiropas uzņēmuma apsakojums par jaunajiem un nākotnes riskiem. Es esmu Linda Matisāne, Eiropas Darba, drošības un veselības aizsardzības aģentūras nacionālā kontaktpunktā Latvijā vadītāja, un šodien moderēšu šo pasākumu. Un pirms ķersimies pie tieši satura, vēlos no tehniskās puses minēt, ka seminārs vai webinārs notiks divās valodās. Pirmā daļa prezentācija būs angļu valodā un prezentēs tieši Eiropas Darba, drošības un veselības aizsardzības aģentūras projektu vadītājs Xavieris Irastorza, bet tulkojums tiks nodrošināts latviešu valodā. Ja jūs vēlaties klausīties šo webināru oriģinālajā valodā, tad to daļu, kas būs angliski angļu valodā un sekojošo diskusiju latviešu valodā, tad jūs varat izvēlēties to YouTube kanālu ierakstu, kur šis tulkojums netiek nodrošināts, bet vienā no šīm YouTube kanāliem semināra ieraksts notiks ar tulkojumu, lai tiem, kam ir nepieciešams tulkojums latviešu valodā, varētu datus precīzi noklausīties. Un pēc tam, pēc prezentācijas, notiks tālāka diskusija latviešu valodā, kur piedalīsies mums sociālie partneri, kur arotbiedrības pārstāvēs Mārtiņš Pužuls, Darba devēja konfederācija pārstāvēs Aija Mortukāne, savukārt Valsts darba inspekciju pārstāvēs tās direktors Renārs Lūsis. Un tagad ķersimies pie darba, ķersimies pie prezentācijas, un es došu vārdu Xavieram Irastorzam, kurš ir Eiropas Darba, drošības un veselības aizsardzības aģentūras zinātniskā projektu vecākais vadītājs. Xavier, the floor is yours. You're welcome. Xabi, the microphone is off. Microphone is still off.
Is it working now? Yeah?
Yes, it is. Thanks.
Okay. Sorry. Okay. And no, sorry. My apologies. And you can see my slides, right? Yeah? Yes, sorry. I assume you can see my slides. Is that correct? Yeah?
Yes.
Positive.
Yes. Okay. Very good. So I just wanted to say thanks for the introduction. Sorry for this problem with the microphone, and thanks for organizing this event today, Linda. We know it takes effort and work, but for us, and I think many of you know the agency, we're not a big organization. It's 65 of us in Bilbao, in northern Spain, and we rely heavily on the work of our network of focal points. So I wanted to express my gratitude for having us all here today and giving me the chance to present the findings of the ESENER survey. with a main focus on Latvia. But it's always a good opportunity for us also to hear back from you and see how the national results resonate with your own experience and other surveys or statistics that you may have. So I'll start with my presentation, as I said, focusing on the results for Latvia. When available, I'll be looking at the previous waves of the survey to look into the evolution over time. And I'll be comparing the results of Latvia with the main average for the EU27 and at times with the results for Lithuania and Estonia too. So I think before starting into going into all those numbers and the information that we have, I think it's good to have a couple of slides to explain what ESENER is about. ESENER stands for the European Survey of Enterprises on New and Emerging Risks. And the big research question that it is trying to address, that we want to shed light on, is how workplaces across Europe are managing health and safety in a very practical way. So we've completed the survey 4 times in cycles of 5 years, so 2009, 14, 19, and 24. It is a telephone survey, but we give workplaces the chance to complete it online. We've always covered at least the European Union member states, plus Iceland and Norway, and Switzerland has covered fully the costs of participating in ESENER in all 4 waves. We've interviewed over 40,000 workplaces in all these countries, employing at least 5 people and across all activity sectors, both public and private. When we talk about workplace survey, I think there is a very clear question as to, okay, who is the person who responds to the survey? In our case, it's the one who knows best about safety and health at the workplace. And I'll be coming back to this later for you to know who this respondent is. The main topics of the survey have remained the same across all survey waves: OSH management, psychosocial risks, worker representation, and the main drivers and barriers to OSH. And then comparability, it is key for us, as I was mentioning in my opening. We want to look at evolution in time, and we can start building trends since 2014. The second time that we carried out the survey, we implemented several significant methodological changes in view of keeping the survey stable over time. So that means that we can already build trends for 3 observation points: 2014, 19, and 2024. So the sample sizes I was mentioning before, we've interviewed over 40,000 workplaces in all 30 countries covered in 2024. And you see how those establishments or interviews are actually panning out by country. In the case of Latvia, we interviewed 756 workplaces. You see how some countries are highlighted in red. In this case, red is good. This is the extra number of interviews that the national authorities funded, paid for, in Austria, Germany, Italy, and Slovenia, in exchange of which they could add a few questions, 2 or 3 questions to their respective national questionnaires. You see Switzerland, as I mentioned before, it is fully in red because we cannot cover Switzerland, but they've participated in ESENER in all 4 survey waves, funding fully the costs of the survey. And comparability, as I mentioned before, over time, but also among countries. So a few details on the survey in Latvia. It was carried out by Norstat Latvia between May and September 2024, mostly over the phone with a team of native speakers, interviewers. There were 7. And interestingly, I highlight there, out of the 756 interviews, 87 of them were completed online. So that makes up slightly over 11% of the total, which is higher than the average. And there I quickly highlight the shares of online interviews in Estonia, almost 20%, and Lithuania, 10%. So I think for the 3 Baltic countries, we see that a higher take-up of the online option. Also by languages, a majority of them, of the interviews in Latvia, were carried out in Latvian, 694, but we gave the option for completion in Russian, which was taken by 62 of the respondents. The address register, this is actually the register from which we draw the phone numbers to call the establishments in Stan and Brad Streets. This is an international register that exists in most countries. And the interview, on average, it took 22 minutes. For the EU27, it's almost 23. So interviews were a bit shorter in Latvia. It is a good sign. because we don't really want to hold interviews for more than 25 minutes over the phone. It is really a long time. And then cooperation rates, these are how many of the shares of establishments that were willing to participate in the survey. It was 21% in Latvia, slightly under the average, which is 27%. These shares are not high, but they are usually what we tend to see in ESENER surveys, like voluntary establishment surveys. I wanted to say ESENER surveys that are equivalent to ESENER. The shares in Estonia and Lithuania were actually a bit higher. The cooperation rates in Estonia and Lithuania were a bit higher than in Latvia. And I want to come back very quickly before going into the findings to the actual respondent of ESENER in Latvia. And here I'm presenting the findings for 2024 broken down by size class. So on the left-hand side, you've got the micro establishments employing 5 to 9 people, and then progressively business size increases all the way to the right for those workplaces employing 250 workers or more. And we see how the pattern changes of the respondent. We see how in the micro, it's this blue category, which are the owner of the firm, a managing director or site manager, who is actually the main respondent of the survey in this particular size class. So for the smaller size classes, we tend to have the manager, the owner, someone who may not necessarily be an expert on health and safety, but that would probably end up replying to any survey that lands on the desk. So this is not surprising. It's the profile that we get in every country. As business size increases, you see how the pattern of the respondent changes radically, and it's an expert on the topic. It's what we call an OSH specialist without a managerial function. So we would be a health and safety officer, a technical expert on the topic, which again, as I said, it is usually the most frequent respondent in all countries. So just wanted to clarify a bit who the respondent is, because we call them best, the ones who know best about health and safety, but we're very interested to know who these persons are and what the role is or are. So let's go into some of the findings, and I wanted to start with what we call a few indicators on the changing world of work, which are mostly on digitalization, hybrid work, and diversity at the workplace as understood by people that speak different languages. And I think the first finding that I wanted to highlight here is that the share of establishments in Latvia that report having employees working from home on a regular basis, it is higher than in the EU27. We had 33%, so 1/3 of our Latvian sample were telling us that regularly they have people working from home. The shares in Estonia and Lithuania are quite similar and higher than in the EU27. I think here it's worth having in mind that the interviews were carried out last year in 2024. We're already a few years after the height of the pandemic, so probably had we asked these questions in 2021 or 2022, these shares would be higher. So we're probably at the tail end of the teleworking situation, but still the shares are higher in the Baltic countries. Interestingly, though, when we ask the establishments whether employees are consulted on working from home practices or if risk assessments are covering home workplaces, the shares are lower in Latvia than in the rest of the EU27. From consultation of workers, it goes down to 52% as opposed to 77% in the EU27. And for risk assessments covering home workplaces, it's 30% of the establishments as opposed to 48% in the EU27. So I think it's interesting to see these things and to share them with you today. For the rest of the indicators, the shares are a bit higher in Latvia, such as the use of digital technologies, whether it's covered in risk assessments, and then very interestingly, whether training is being provided in other languages. We ask this question to those establishments that tell us that they have employees with difficulties understanding the main language spoken at the premises. It's not really a lot of establishments. In Latvia, it's 9%, but it's very interesting to see how 65% of the establishments, they will provide training in other languages, which is clearly higher than what we see in the rest of the EU27. So this was by way of introduction to some of the topics that I think are very, very hot and very much on the agenda. But now I want to move on to the risk factors. This is one of the most important findings of the survey, this question that we've asked across the different waves of the survey. And here I'm focusing on the results for Latvia, comparing 2019 in orange and 2024 in blue. So I think the first things that probably catches our attention, and I always like to focus on this first interpretation, right? When you see this picture, what's the first thing that comes to your mind? Is that in general, risk factors, the blue ones, have been less frequently reported than in 2024 than in 2019. So there's been a bit of a decrease in the reporting of risk factors. We see how the orange bars are a bit bigger than the blue ones. But very interestingly, the top 3 risk factors are musculoskeletal disorders, repetitive hand or arm movements, which increased slightly, prolonged sitting, which decreased, and lifting or moving people or heavy loads, which has increased all the way to over 60% of establishments in Latvia. So I think the first message today is musculoskeletal disorders being the most frequently reported risk factors in Latvia. We don't want to forget about psychosocial risk factors, of course. Difficult customers is still in the top. It was number 3 in 2019. It's number 4 now. There's a bit of a decrease. The same goes for time pressure. So another message that we could take home today is that the reporting of some of the psychosocial risk factors that we've got in the survey has actually decreased between 2019 and 2024. Something else that I wanted to quickly share with you is, okay, how the average of the U27 is. And you see again that the pattern is quite similar, but maybe the reporting in the U27 is a bit lower for most of the risk factors than it is in Latvia. So in a way, we could see how this reduction in the reporting in Latvia between 2019 and 2024 might actually suggest some kind of convergence with the U27 average. But still, for most of the risk factors, the reporting is a bit higher in Latvia than in the rest of the U27, particularly for increased risk of slips, trips and falls, heat, cold or draft, chemical or biological substances, and also risk of accidents with vehicles in the course of work. And then I want to go back quickly to psychosocial risk factors. We've got 5 psychosocial risk factors in the questionnaire, which I highlight there. And we're very keen to know about those establishments that have none of these psychosocial risk factors. They make up 22% of the Latvian sample. For the U27, it's actually 25% of establishments that tell us that have none of these psychosocial risk factors. For us, it is very interesting to look a bit deeper into them, because we think there might be an issue of awareness as to what represents a psychosocial risks. You see the shares in Estonia, it's 19% that don't have any psychosocial risk factor, whereas in Lithuania, it goes all the way up to 44% of establishments in Lithuania that we interviewed last year would tell us that they had none of these psychosocial risk factors. So something that maybe I should have introduced before, because it's the cornerstone of our approach to prevention in Europe, is whether establishments are carrying out some kind of workplace risk assessment. And we see how the average for the U27, again, 2024 in blue, 2019 in orange, is 76%. We see that in the case of Latvia, the share has remained constant since 2019, slightly over 82, 83% of establishments tell us that they carry out some kind of risk assessment. And the shares for Estonia are a bit higher. And for Lithuania, there has been an increase since 2019. But I think they are all between the 75, 82% mark. You see that the picture is quite different across countries, and it's interesting to look a bit deeper into this. We've seen some countries increasing the shares, others decreasing, but for us, in order to shed a bit of light into workplace risk assessments and all these numbers that we have a few follow-up questions that maybe help us understand a bit better how these workplace risk assessments are actually carried out. We're keen to know who is taking care of these risk assessments, and we ask establishments whether they are conducted mainly by internal staff. And we see that in the case of Latvia, it is the case for 51% of the establishments. So the share is higher than in the rest of the U27, which is an interesting finding. And we see also in the Nordic countries how a majority of establishments, even the micro and the small, are mostly carrying out these risk assessments with their internal staff rather than subcontracting it. We also are keen to see whether workers are involved in follow-up measures, and we see that a majority of the establishments that carry a risk assessment actually tell us that yes, they do involve workers in any follow-up measure that they might be implementing as a result of that risk assessment. And then we want to know what aspects are actually covered in the risk assessments. And we see that the picture is actually relatively similar between Latvia and the EU27. In brackets, right next to the Latvian figures, I present the results for Estonia first and Lithuania. Here, maybe just highlight that when it comes to exposure to noise, vibrations, heat or cold, it's actually more frequently included in the risk assessments among the Latvian workplaces than in the rest of the EU. And the same goes for the use of digital technologies, which is more frequently included in Latvia than in the rest of the continent or the EU 27. So now I want to link to the risk factors and the clear picture that we saw about musculoskeletal disorders topping the ranking of risk factors, number 1, 2, and 3. We have a question which we call or introduce here as work design measures. These are measures actually very much gearing towards preventing musculoskeletal disorders. And it is actually a bit concerning to see that despite the increasing share of reporting MSDs, the actual measures to prevent them haven't really followed up. Of course, we don't know what comes first, and in ESENER, we cannot establish causality, so we can only look at correlations. But it is interesting to see how the measures have in general decreased since 2014. I'm presenting here the findings for 2014 in green, 2019 in orange, and 2024 in blue. We've got 5 measures, and the one most frequently reported is the provision of equipment to help with the lifting or moving, which has decreased between 2019 and 24. And interestingly, the reporting of lifting or moving people or heavy loads has increased in these 5 years. So I think it's good to have this in mind and to see how, in general, there was like a drop in 2019, and then in 2024, we are seeing how these blue columns are increasing again and being a bit bigger than the orange ones in 2019, except for this one, the provision of equipment to help with the lifting or moving. So just wanted to share this with you and just look at these 5 measures that we have in place. These are the averages for the U27, and we see how in general they are quite similar to the Latvian results, except for the provision of ergonomic equipment. That's the second measure, where it is more frequently reported in the rest of the EU than in Latvia. But there's been a recovery since 2019. A very important piece of information in the survey, and again, I'm sharing the findings since 2014 in green, 19 in orange, and 2024 in blue, are what are the main factors that motivate action in the management of health and safety? Why are establishments managing health and safety? And we see, interestingly, well, first we see that these are reported very frequently by establishments when it comes to the main reasons. So a majority of them are telling us that they have a reason. And in the case of Latvia, is maintaining the organization's reputation. 90% of establishments tell us that this is the main reason why they're managing health and safety. This is followed up by maintaining or increasing productivity, and then fulfillment of legal obligations. So these 3 are reported by more than 80% of establishments. I think it's interesting to highlight this one because in a majority of countries, it's the legislation, fulfillment legal obligation, that would be the number 1 driver. In the case of Latvia, reputation actually seems to be a very important factor. And I wanted to highlight this one today with you because it's something that we've seen in previous waves of the survey too. It's always been an important driver, and it is different to what we see in other countries. And now I want to look at the barriers. What are the difficulties? And I think, again, I was mentioning before, what's the first impression that you get when you look at the chart? Here, the first one is like, wow, they're not really that frequently reported. So establishments are not complaining that much about difficulties or barriers. You see how the columns are much, much lower than when it comes to the drivers. The number 1 would be complexity of legal obligation, which increased, but it's still under 20%. It's a very interesting finding, actually, because when it comes to legal obligations regarded as being complex, the perception across Europe is very, very diverse. In some countries, it's much higher than in Latvia. In others, it's like the ones in Latvia or even lower. And then what we also see is that this perception changes between waves. So countries where it might have been very high in 2014, then it dropped in 2019, then it came back again in 2024. So this perception is not stable. And by checking with other countries, I'm not talking about Latvia in this case, we see that often this perceived complexity seems to be linked to changes in the legal framework. So it doesn't necessarily mean that it's more complex, but it does mean that changes have taken place, and these are perceived as difficult by establishments. But again, not the case of Latvia. There's been a slight increase, but still under 20%. And then I also wanted to mention how lack of money seems to be less of a challenge or barrier to manage health and safety. Again, we've witnessed this in many, many countries across the EU27. Among the different drivers that we had, and I didn't mention before, we had avoiding fines from the Labour Inspectorate. This was reported by slightly around 80% of the establishments. So we have a question in the survey, and we asked establishments whether they have had a visit by the Labour Inspectorate in the 3 years prior to the survey. Here again, I'm comparing the results for 2019 and 2024 for all European countries, European Union countries. And we see how, in general, the orange bars, 2019, are bigger than the blue ones. So this is telling us that there's been a reduction in the shares of establishments that have had a visit by Labour Inspectorate. I think this doesn't surprise anyone. In general, we know that this is the trend, and the survey is picking up on it. So in Europe, the average for the 27, 40% of establishments were telling us that they had had such a visit. For Latvia, it's a bit lower. There's been a bigger drop, and I think it's 38% of establishments that had such visit. And for Estonia, there's been a reduction too, but still over 50%. And in the case of Lithuania, there's been a very minor increase and still is under 35%. So I think the message here is that labor inspectorates still have a strength in many ways. And definitely when we ask establishments as a driver for action, a majority of them tell us that indeed avoiding fines from labor inspectorate or fulfilling legal obligation is a very important driver. But at the same time, we're seeing how an increasing share of establishments are having no visits from the labor inspectorate. A new question that we included in 2024 when it comes to engaging or fulfilling our standards, we wanted to see the influence of the supply chain. And we asked establishments employing less than 50, so we didn't ask to all workplaces, only to those that are micro and small. We asked whether they had to meet requirements from clients or suppliers to meet our standards. And here we see how the data pans out by country. And in the case of the EU27, the average, it was 50%. So half of our share said that yes, they had to meet such or standards due to requirements from clients and suppliers. By country, I think it's very interesting to see how the shares differ. And in the case of Latvia, it was 40% of micro and small establishments that would tell us they had such requirements, and a bit more in Lithuania, and I think in Estonia is actually the same as in Latvia. But I think it's good and interesting to see how the picture changes by country, how in some countries it's 70% of the micro and small report such requirements, and in others it's only 30%. So just wanted to show this new item, this new question in ESENER 2024. Now I want to focus on my next few slides on psychosocial risks, and we have a question on procedures to deal with psychosocial risk. Here I'm presenting the findings for Latvia, Estonia, Lithuania, and then the average for the U27, and looking into 2019 and 2024 for each of them, and for the three procedures that we asked about on work-related stress, bullying or harassment, and violence. And we see that for Latvia, there's been an increase between 2019 and 2024, particularly for stress-related procedures and bullying or harassment. For violence, there's been a bit of a decrease, actually. The pattern is the same in Estonia, even though the numbers are a bit lower. So we see also an increase between 2019 and 2024 when it comes to procedures to deal with stress and harassment or bullying, but a slight decrease when it comes to violence. And in the case of Lithuania, there's been a massive increase between 2019 and 2024. I think it's worth looking a bit deeper into it and check with our Lithuanian colleagues and counterparts to see this increase, how we can explain this evolution since 2019. But in any case, very, very interesting. For the EU27, I think the picture is actually quite similar to the one we saw in Latvia and Estonia, an increase for stress and bullying or harassment, and a slight decrease for violence. We're very keen to know when it comes to dealing with psychosocial risks, how workers are involved. And we have a question to establishments that have measures in place to prevent psychosocial risks. So only for them, for the establishments that are dealing with psychosocial risks, we have a follow-up question, which goes, and are employees involved in the definition of such measures? And interestingly, we see how many of them aren't actually, and the shares are decreasing. So in a way, theoretically, we would expect these bars to go all the way to the right. These are establishments that are active in the prevention of psychosocial risks, but we see that they're really not involving workers. And if we compare 2019, again in orange, and 2024 in blue, these shares are decreasing. In the U27, for instance, there were 61% of such establishments involving workers. Now it went down to 55% in 2024. In the case of Latvia, the trend is the same. It went down to under, I think, 47% of establishments that have measures in place would involve workers. And the trends for Estonia and Lithuania are actually a bit different, because there's been an increase in the involvement of workers, and now both of them made it past the 50% share. But in general, I think it is interesting to see how in most countries these shares are decreasing. And also when it comes to the geographical distribution in Europe, and again, this goes in line with previous research and previous survey findings, the Nordic countries would still have the highest share of worker involvement in measures to deal with psychosocial risk, which comes as no surprise. We also ask establishments whether they have enough information to include psychosocial risks in the risk assessments. And here I'm sharing the findings for 2024, broken down by country. Majority of establishments in many countries say that they do have enough information. That's the case for 63% of workplaces in the EU27. In Latvia is a bit lower. I think it's 56% establishments would claim to have enough information. And when it comes to Estonia and Lithuania, they are closer to the EU average, around this 66% average. And then we have, I think it's a very interesting question. We ask establishments that report having at least one psychosocial risk factor. We ask them whether they find them more difficult to manage than other risks. And interestingly, a majority of establishments do not regard psychosocial risks to be more difficult to manage than other risks. In the EU27 is actually 21% of establishments, so it will be 1/5 of our sample that claim psychosocial risks to be probably more difficult to manage than other risks. It's even less in Latvia, 18% of establishments, and in Estonia, maybe it would be out of the Baltic countries, the one reporting a higher share of establishments that find them more difficult, as opposed to Lithuania, where only 15% of establishments would claim them to be more difficult. Again, the Nordic countries top the ranking when it comes to this perceived difficulty. And what makes psychosocial risk more difficult to manage than other risk? And it's about the reluctance to talk openly about the issue. We've seen this in every survey wave. So this is a very consistent finding across a majority of countries, and as I said, across time. And then lack of awareness among the staff, and the lack of expertise or specialist support. So these would be the main challenges that these 18% of establishments in Latvia would report. So we only ask these difficulties to those that regard the psychosocial risk to be more difficult than other risks. And I'm going to the end of my presentation, just digital technologies and worker representation to go. With digital technologies, here I'm focusing on 2024 Latvia in this light yellow color, the EU27 in blue. And we see on the left-hand side two technologies that, I mean, one could argue, I mean, it's PCs and laptops. I mean, we had to cover these more traditional technologies in order to engage in a digitalization conversation with workplaces. Remember, we cover all activity sectors, all size classes in many countries. So we really had to include these two, and understandably the shares are very high. But what is interesting for Latvia is the 5 more sophisticated technologies. The reporting is actually higher for all of them. And here I highlight wearable devices, then machine systems or computers that use artificial intelligence, and then robots that interact with workers. I think it's interesting to share this with you, how establishments were telling us that they use these technologies, and the shares are actually higher than in the rest of the EU27. If we look at this finding, only 6% of establishments in Latvia report to using none of these technologies considered, and the shares are even lower in Estonia, 2%, and Lithuania, 4%. We're very interested to know, though, when it comes to digitalization, whether there is a link between the use of digital technologies and the impact such use may have on the health and safety of workers. And we see how the share has increased between 36% in 2019 all the way up to 43% in 2024. These are the establishments that tell us that they discuss about the potential impact of digitalization on the health and safety of the workers. One could argue the shares are not high enough. There's still a missing link between digitalization and OSH, but the trend, this increase since 2019, it is quite clear, and we've witnessed it in every country. And again, it comes as no surprise, all the changes brought about by the pandemic. And I think discussing about the impact, I think there's been an increased awareness. So we're not surprised to see the trend increasing since 2019. Here I'm showing the findings for this particular question by country. So we're asking whether this impact of digital technologies on OSH is discussed, and we see how in Latvia, as I mentioned before, it was this 43% of establishments that do it, higher than the EU27 average. And the same goes for Estonia, almost 40%, and then Lithuania, that is top in the ranking. More than 56% establishments would claim to discuss such impact of digitalization on health and safety. And then we have a new question, or that we phrase it differently in 2024, regarding the risk factors that are linked to the use of digital technologies. And I think it's very, very interesting to see here, 2024, EU27 in blue, Latvia in light yellow, how repetitive movements and prolonged sitting are the number 1 and 2 risk factors linked to the use of digital technology. So again, we're digging deeper into MSDs as a risk factor. We had it as the main risk factors in general, but then we're focusing the discussion or the debate, digitalization, again, Latvian establishments, and not only Latvian, but in the EU27 too, they would rate them as the most frequently reported risk factors, repetitive movements and prolonged sitting linked to digitalization. I think it's interesting to highlight though, because the shares are clearly higher in Latvia than in the rest of the EU, these 3 risk factors, the lack of ability to work with digital technologies, working alone and isolated from colleagues, and the loss of worker influence over work pace or processes. These are more frequently reported in Latvia than in the rest of the EU27, and I really wanted to share these ones with you today. I'm sharing the findings for Estonia and Lithuania here, Estonia in blue bars, Lithuania in green bars, and we see how, while the pattern is quite similar, I would say that in general, the risk factors are less frequently reported in Estonia than in Latvia, except for increased work intensity and information overload, where these two are more frequently reported in Estonia. And then when it comes to Lithuania, the pattern is, I would say, in general, again, quite similar to the one we witness in Latvia. MSDs, again, number 1 and number 2 risk factors, and maybe for other issues, maybe we can see a less frequent reporting in Lithuania than in Latvia. And then, as I said, the last part of my presentation today, we're looking into the forms of employee representation. Again, focusing on 2024, Latvia in yellow or sand color, and the EU27 average in blue. Again, first reaction to this picture, the shares in Latvia are clearly lower than in the rest of the EU27. The most frequently reported form of employee representation is a health and safety representative, but still is reported by less than 30% of the Latvian establishments that were surveyed in ESENER. So in general, across the EU, we have 1/3, 31% of establishments that report having none of these forms of employee representation. But this share is clearly higher in Latvia. 65% of establishments in Latvia reported having none of these employee representation bodies. The shares, it was 25% in Estonia and 50% in Lithuania. And again, I'm presenting the findings for Estonia in blue, and we see how the picture is quite similar to the one in Latvia, except for health and safety representatives, where in Estonia, there is 70% establishments that would have such a form of employee representation. And again, quite similar in Lithuania. The shares are higher than in Latvia, and particularly the case for a health and safety rep. So I want to finish my presentation when it comes to findings with these health and safety reps. We want to know how they are appointed. And we see how in some countries, and you see how they're highlighted in dark green, most of them like for instance, Finland and Norway, 81% of establishments in Norway and Finland, these health and safety reps will be elected by fellow employees. But it's really not the case in every country. And we see that in Latvia, it's 33%. So 1/3 of our share of establishments that had a health and safety rep in Latvia, when we asked them, and how did you or how were they appointed, we see that 33% of them would have them elected by fellow employees, but many of them would have them selected by the employer. So again, this is not good or bad, but I think many would assume that when you're talking about health and safety rep, that they've always been elected by fellow employees. But we see how it's not really the case. And it is in some countries, but in many others, it's actually to the contrary. They're usually selected by employers. So I finished my presentation, all the data and numbers, and I wanted to give you a bit of information on where we are and what the next steps are. So a few months ago, we published our first reports, our first publication, going through very quickly the main findings of ESENER. This is a short publication, the first findings report. And then in July, we published a presentation with the key insights from these findings. Very recently, last month, we published an ORIG Wiki article with the methodology of ESENER 2024. Here, we don't only explain the methodological approach, we also upload our technical report, quality report, translation report, and very interestingly, all the national questionnaires. So for those who are interested, you can have access to the Latvian questionnaires of ESENER, both in Latvian and in Russian. And only a couple of weeks ago, we uploaded the dataset of ESENER 2024 at GESIS. This is for researchers for free downloads. They can carry out their own statistical analysis. We've done it for the previous wave. So it's something that we're always looking forward to have the research community involved in analyzing the ESENER findings. We are now digging deep into the numbers and trying to make as much sense as possible of all these quantitative data. We have a follow-up study now that we launched a few months ago on mental health and digitalization. We're going back to ESENER respondents in a few countries and having interviews at the workplace with a manager and a worker on mental health and digitalization. Preliminary results of this study should be available by the end of 2026. We'll soon start work on the overview report. That's the flagship publication where we analyze the results of the 3 survey waves in depth. And then the data visualization that I think most of you know. It's a simple way to navigate through the main findings of the survey, translate it into every language. No need for statistical knowledge. It's just playing with the graphs and charts and maps. I think I have a screenshot of that later. And then this year, we've been very busy and keen and happy to disseminate the findings at different events, the EU presidencies, national events like the one organized today. You see that we've been very active this year, and our network of focal point has been very busy, helping us promote the findings. And then also conferences. We see an increasing interest in sharing our experiences at scientific conference on survey research methodologies, and also events organized by our EUSHA stakeholders, the different interest groups. So that's the data visualization. That's a screenshot of the tool in Latvian. It's available in all the languages covered by the survey, and it will be available, the new tool, updated with the latest findings and the latest results in January 2026. So we already started working on that. So hopefully we will be able to kickstart the year with some good news when it comes to the data visualization. My last slides, we see how the use of digital technologies has increased, not only Latvia, but everywhere. But for us, we want to make sure how hybrid work, remote work, teleworking, whether workers are consulted or not, whether risk assessment is actually being adapted to cover these new situations, whether workers are receiving training on them. We're pleased to see an increased awareness when it comes to the link between health and safety at work and digitalization. But one could argue whether there's still something missing there. So probably more work needs to be done there when it comes to increasing even more awareness. The risk factors linked to digitalization, we found them very interesting, and I think it's very relevant again to bring to the table how MSDs were the most frequently reported risk factors linked to digitalization. And then follow-up studies will be working first on mental health, which will also help inform the next campaign of EOSHA. So I think all I have to say is thank you very much for your attention. And I don't know, Linda, if there are questions to be taken now or later, I'll be happy to reply also in the future. I'm aware it's a lot of information shared today, and most people will probably need some time to digest all this data. So if okay with you, I'll stop sharing and I'll get to see you again now. Yeah.
For the very interesting presentation, and I got some also I think surprising data for me as well. But I wanted to yes, we have some 3 questions for you, and the first is I wanted to link to what I said in the introduction regarding these fatalities and severe workplace accidents. So I mentioned that the Latvia ranks among the worst countries when looking at these numbers of fatal accidents. If we combine these Eurostat data with ESENER data, can you see in the data any explanation why we are so bad in these fatal numbers of and severe numbers of accidents in Latvia? Yes, Xabi,
Okay.
please.
Yeah, sure. I go ahead. Can you hear me? Yeah.
Yep.
Yeah. Okay. Yeah. Thanks for the question, Linda. I think it's a very interesting one, and you know, I think you're already after all these years familiar with ESENER. We don't have outcome questions in ESENER, but it is true that when you dig into the questionnaire, there could be a few hints that could help us. I don't know if explain, but maybe understand why this data in Eurostat and accidents at work is ranking Latvia so highly. I think maybe one of the things that we can look into is the risk factors, and probably you don't remember, but most of the risk factors in Latvia were more frequently reported than in the rest of the EU27. So even though in some cases there's been a big decrease, still risk factors are more frequently reported in Latvia. So this could be a first maybe indication that there is something there. And if you look again into each of the risk factors, when it comes to the 2 that we have on accidents, accidents with vehicles in the course of work and accidents with machines, they are more frequently reported in Latvia than in the rest of the EU27. So I think this could be a first entry into, okay, what can ESENER contribute to try and understanding these findings from the ESO? I think also other risk factors like increased risk of slips, trips and falls, lifting or moving people or heavy loads, chemical or biological substances. Again, these ones are clearly more frequently reported in Latvia than in the rest. So not a definite explanation, but something that can help us understand. Something that I didn't present today, we have a question on the use of health and safety services. Here we have like whether establishments are using an ergonomist or an occupational doctor or a psychologist. And here it is true that Latvia ranks clearly lower than the U27 average. And particularly for one of the items on an expert on accident prevention, we had 33% of establishments in Latvia claiming to use such expertise every now and then, and the share in the EU27 is clearly higher, 52%. So I think that maybe we can discuss each of the items, but when we look at the use of health and safety services of expertise, again, the shares are lower in Latvia than in the rest of the EU27. And maybe one final thought, we also ask establishments whether they have a record of work-related accidents. Again, probably this doesn't have anything to do with the statistics that we get from Eurostat, but we were surprised to see that the share of establishments in Latvia that have such a record is clearly lower than in the rest of the EU27. In the EU, is 85% of establishments have such record of work-related accidents, and in Latvia is 65%. So there are 20 percentage points there that I think it's quite significant. And as I said, we cannot probably use ESENER as a single source to justify or explain those data from Eurostat. But I do think that by looking into the Latvian results, there are 2 or 3 indicators that can contribute to maybe help us understand a bit more those statistics. Yeah.
Okay, thanks for these ideas. I haven't thought about them, but another thing what is I've been looking is workplace risk assessment. As you mentioned, it's the core or the basics, and I fully agree with the fact that if you have very good and proper workplace risk assessment, then it's the basis for the whole management system. And in the data, we can see that the number of the companies reporting having workplace risk assessment is increasing, but it's not 100%. We haven't reached the full compliance. I mean, when we were looking also at the data from other countries, even the best countries, they have like 80%. Do you think it's possible to reach that full compliance of 100% of companies doing risk assessment? And do you see any role for national authorities or sectorial partners to further promote doing risk assessment, especially in small and medium-sized companies?
Yeah, well, thanks a lot for the question, Linda. Yeah, I mean, it's a tricky one. I think it is. I would say it's very, very difficult to ensure 100% compliance, particularly when we're looking into a survey like ESENER that includes micro and small. I have to say that we do even have some large establishments that tell us openly that they don't carry a risk assessment. This is just really very few of them, and it is usually the micro and the smallest that would tell us that they don't. So to answer your question, the numbers are what they are. I think it's extremely complicated. I think the shares are quite high in Latvia, higher than the average. I think it's interesting also to look how in Latvia a majority of establishments carry out these risk assessments internally, and so these would probably be the positives. At the same time, I think when it comes to risk assessment, we were a bit concerned to see that lower coverage of home workplaces and the slightly lower worker involvement in follow-up measures. So I think this is like a bit of an introduction to the results in Latvia. When it comes to ideas, what could be done to try and I wouldn't say ensure, but try and motivate or fight for this 100% coverage? I want to remind or go back to the finding on the drivers. I think it was very, very interesting to see how the main driver for action in Latvia for managing health and safety was the organization reputation. I wonder whether this could be used somehow by the national authorities or regional bodies, sectoral, social partners, just to try and share about these cases of establishments, even very small, that are carrying a risk assessment, to use it from a reputational point of view in a good way, motivating way. So I was thinking along the lines of corporate social responsibility, and while other drivers are important to us at EUOSHA, it was an eye-opener to see this reputation as a main factor for action in Latvia. And we're wondering, I mean, now that you're asking me this question, whether this could be used somehow. Because at the same time, we see some challenges. I mean, labor inspector visits are decreasing, as in other countries. The question that we had about the supply chain to actually try and motivate establishments to meet certain OSH standards, it is lower as a request in Latvia than it is in other countries, and also it will be difficult to ensure how to encourage this, the supply chain as a motivator of managing OSH. And to us, I think it's very, very important to talk about worker representation and participation. It is clearly lower in Latvia than in other countries, and we would say that it could probably be a main challenge. Research shows, and previous analysis of ESENER show, that usually we tend to see workplace risk assessments in those establishments where there are worker representation bodies appointed and worker involvement. Again, we cannot talk about causality in ESENER, but they are correlated. And probably it's something that is holding back those few establishments that have no workplace risk assessment. We were wondering whether maybe it could be also linked to this, to the lack of having worker representation. But yeah, it is a tricky question, and I'm afraid I don't have a clear single answer. Yeah.
And it's good you mentioned this worker representation and involvement. One of the surprising facts for me were about the management of psychosocial hazards, where the employers do not involve employees, workers in the management, and that might in practice mean that workers care about lack of time, but the employers provide training with dealing with with conflicts and difficult clients. I mean, despite the fact that there have been a lot of different events related to occupational health and safety on mental health or psychosocial hazards in workplace in Latvia, there are still companies that say that it's more difficult to manage these psychosocial hazards than, let's say, traditional ones. Can you look maybe from the data and say which are those companies who tell it, who say it, and do you see what kind of support that we should provide for those companies?
Yeah, that's a great question, Linda. It's something that I think it is an issue in many countries. It's probably not only the case of Latvia. I think, as you said, there are lots of events. There is a discussion even in the public agenda. I mean, we've been all of us more aware about mental health and after the pandemic. So I think the question is extremely relevant. So looking into those establishments that report psychosocial risks to be more difficult, it is very interesting to see. I mean, first of all, there are not that many. So let's showcase the impact of all these events that you're referring to, because only 18% of establishments are telling that they are more difficult. So maybe all these awareness raising actions are actually having an impact already. But when we focus on this 80% by size, we see that interestingly, they're usually the largest establishment. So as business size increases, this reporting of difficulty increases too. So more and more establishments, when the establishment size is bigger, they actually say that it's more difficult. It is very interesting because this seems to be correlated with actually the fact that they are being more active in the prevention of psychosocial risks. So we see this, and we also see it by country, actually. The countries that are more active in the prevention, they claim this difficulty to be more prevalent. So by size, they are mostly bigger size establishments, like medium size or bigger size establishments. And then by sector, it is very revealing that it's mostly workplaces in public administration, human health and social work activities, and education. So these are the establishments that would report this difficulty when it comes to psychosocial risks, as opposed to agriculture at the other end. So I think it's interesting when we're talking about these difficulties, and as a response to your question, to see, okay, who are the establishments, or where are they, how to overcome, and what support they need. This is tricky because they openly tell us that, okay, sensitivity of the issue, the lack of reluctance to talk openly about the issue is a problem, lack of awareness, they say. Almost 50% of establishments in Latvia that claim this difficulty say it's due to a lack of specialist support. So I was looking again to the use of the health services, and I think one of my previous answers I was talking about it, how in Latvia establishments are using these occupational health services less than in other countries, and I was wondering whether the use of a psychologist could help in some cases. And I was looking at the data for Latvia, and only 12% of establishments in Latvia would claim that they've used a psychologist every now and then, as opposed to 21% in the rest of the U27. So I wonder whether when we're talking about this lack of specialist support, whether they could be referring to this, but we cannot really answer by looking at the ESENER questionnaire findings. The procedures to prevent psychosocial risk are slightly lower in Latvia than in the U27. And when we look at the measures, we see that the most frequently reported measures in Latvia when it comes to preventing psychosocial risk were allowing employees to take more decisions on how to do their job, so giving them more autonomy, and also intervening if excessively long or irregular hours at work. So these will be the two most frequently reported measures. But as opposed to these, we see like Latvia is lagging behind when it comes to measures such as reorganizing work in order to reduce job demands and work pressure. So we're wondering whether more action when it comes to these measures would maybe have a positive impact. We also saw that there is a share of establishments in Latvia that claim that they have enough information to include psychosocial risk in risk assessment, but this share is lower than in the rest of the EU27. So again, establishments in Latvia seem to be missing out maybe more on info on how to include psychosocial risk in risk assessments. So for me, and just maybe to finish, I think a problem too, and we mentioned that before, is the involvement of workers in and employee involvement in the management of psychosocial risk. I think it's all linked to the issue, to this perception of difficulty, maybe to this lack of employee representation, and whether maybe a better dialogue at the workplace level could maybe help when it comes to managing psychosocial risk. So this would be my quick reactions to this question. Yeah.
Okay, thanks a lot, Xabi, for the presentation and answering to the questions. We don't have any other questions received related to the results of the ESENER survey. Thank you very much for the presentation, and I'm going to switch to Latvian now. Thanks.
Thank you so much.
Jā, un tagad, lai paskatītos uz to, ko tas nozīmē šie dati Latvijai, vai un kā mēs varam viņus izmantot, es sarunā aicināšu piedalīties mūsu sociālo partneru pārstāvjus, un sarunas pirmajā daļā sarunā piedalīsies Aija Mortukāne, Latvijas darba devēju konfederācijas darba aizsardzības eksperte. Labdien, Aija! Un Mārtiņš Pužuls no Latvijas Brīvo arotbiedrības savienības darba aizsardzības, konsultants darba aizsardzības jautājumos. Labdien, Mārtiņ! Un ieskatoties datos, mēs redzējām jau to, ka divus tādus, man liekas, svarīgus aspektus. No vienas puses, līdzīgi kā iepriekšējos pētījumos, arī šobrīd situācija Latvijā mazajos uzņēmumos vai mikro uzņēmumos un mazajos uzņēmumos darba aizsardzības jomā ir sliktāka kā lielajos uzņēmumos. Viena lieta, un otra lieta ir šie darbinieku iesaiste darba aizsardzības jautājumu risināšanā arī ir būtiski sliktāka Latvijā nekā vidēji Eiropas Savienībā. Un mans jautājums saistībā ar jūsu kā sociālo partneru viedokli ir, kādā veidā mēs varētu palīdzēt šo situāciju Latvijā mainīt, īpaši saistībā ar darba vides riska novērtējumu, kas ir šīs darba aizsardzības sistēmas pamatā, un vai jūs kā sociālie partneri redzat kādas vēl jaunas papildus iespējas, ko mēs varētu darīt, lai atbalstītu šos mazos uzņēmumus darba aizsardzības jomā un it īpaši, varbūt uz runājot par darba vides riska novērtējumu. Varbūt pirmajā Aijai došu vārdu. Lūdzu, Aija.
Jā, paldies. Ir ļoti svarīgi, ka mums ir iespēja šos datus tā no malas apskatīties, un paldies, protams, par to, ka šie pētījumi tiek veikti, un mēs varam tā kā fokusēties tiešām uz acīm redzamiem rezultātiem. Un tas, ko no manas puses vai no kā darba devēja konfederācijas puses mūsu uzņēmēji ir atbildīgi, un lielākā daļai, protams, ir atbildīgi pieeja, tā skaitā arī pie darba aizsardzības, un tas, ko mēs droši vien no tādu lielāku uzņēmumu puses varētu darīt, piesaistot šos apakšu uzņēmējus, viņiem attiecīgi arī pieprasīt šo informāciju par viņu darba aizsardzības sistēmas organizāciju, dokumentāciju, un tādā veidā, teiksim, mēs vai lielāki uzņēmumi šo darba aizsardzības sistēmu kontrolētu arī savā pusē mazliet. Tad, ja tiktu prasīts apakšu uzņēmējam uzrādīt šo dokumentāciju pirms, piemēram, darbu veikšanas, tad arī mazie uzņēmēji būtu spiesti īstenot, jo prasības, protams, mums šobrīd ir visiem līdzīgas, bet bieži vien esmu dzirdējis tādas atbildes, kad man neprasīja, man nevajadzēja, bet ir labi, ja kāds tomēr laikam to uzprasa speciāli. Tā kā mans vēstījums vai doma ir tāda, ko mēs varam darīt, ir tas, ka šie lielie uzņēmumi ar labo praksi savā uzņēmumā var prasīt šo pašu praksi īstenot arī mazajos uzņēmumos, piesaistot viņus kā pakalpojumu sniedzējus.
Paldies, Aija. Man liekas ļoti jauki, ka sasaucās tā piegādes ķēžu ideja, ko mums eksperts teica ar to, kas ir praktiski iespējams arī izdarāms Latvijā. Mārtiņa, arotbiedrība viedoklis.
Man jāsaka tā, ka drīzāk tas būs pagaidām mans viedoklis, jā, jo arotbiedrība viedoklis izskatās, ka diezgan pabēdīgs, jā, jo paskatoties uz šo darbinieku pārstāvniecību, jā, par ko mēs kaut vai savās konferencēs parasti vienmēr runājam un sakam, ka mums tas ir nepieciešams, jā, mums tā ir tāda, tāda neaizņemta niša, ko mums vajadzētu aizņemt, jā, lai mēs attiecīgi varētu piedalīties un tā. Man tajā diskusijas pirmajā daļā ļoti patīk tā ideja par to, ka ļoti bieži darba aizsardzības speciālists, kurš ir izvērtējis šos riskus, jā, viņš ar tādām lielām apaļām acīm skatās uz to, ka darbinieks par šo risku izvērtējumu neko nav zinājis, jā, un nedēļas kādas 4 tam atpakaļ, jā, tātad tas tieši saskāros ar šādu, kā teikt, situāciju, kad darba aizsardzības speciālists, kuram mēs prasījām uzrādīt šos darba vides risku izvērtēšanas protokolus, jā, un teica, tas ir mans know-how, es to taisīju, jā, jums nevajag pie tā piedalīties. Racionālais grauds vienmēr darbinieku pārstāvniecībā un Eiropas Savienībā tā ir diezgan, kā teikt, spēcīgi, jūs pēc cipariem redzējāt, jā, ceļš, piemēram, Ziemeļu valstīs un tam līdzīgi. Mums līdz šim ciparam ir, kā teikt, ļoti tālu un ļoti pamatīgi, jā, jo, piemēram, šī brīža situācija, kad arotbiedrības, kā teikt, privātbiedrības savienības speciālisti darba aizsardzības nozaru speciālisti, jā, runā par, tām lietām, kas cilvēkam liekas ļoti interesanti, ļoti vajadzīgi, jā, tātad viņi runā par šīm virsstundu apmaksām, jā, tātad par šo samazināto laiku un tam līdzīgi, jā, bet ļoti svarīgi un ļoti būtiski, lai arī attiecīgi šajā risku izvērtēšanas procedūrās mēs varētu piedalīties, jā, un attiecīgi, kurš tad zina labāk tos riskus, jā, viņš varbūt, ka nezina viņus nosaukt skaisti, jā, kādos skaistos vārdos, un tas ir tas darbinieks, kas to zina, jā, un tajā brīdī, kad viņam ir atnācis darba aizsardzības speciālists un lūdzu parakstīt šo dokumentu, viņš tā laikam pakautrējās paprastīt, pastāstiet man kā kaut ko par šiem riskiem un tā, jā, tad tā ir tā sistēma, bet ja mums bija, piemēram, šajā uzņēmumā būtu darba aizsardzības pārstāvis, jā, uzticības persona, man ļoti patīk šis vārds, jā, uzticības persona darbinieku, jā, un viņš jau būtu arī sagatavots, teorētiski sagatavots šai, kā teikt, darbībai, jā, viņš varētu ar darba aizsardzības speciālistu runāt daudz tuvāk, daudz labāk. Tad, kad man atsūtīja šo jautājumu, jā, es tā domāju, ko tad es varētu, kā teikt, labu tādu piedāvāt, jā, nezinu. Bet man patīk, ka 2008. gadā, kad bija, manuprāt, vēl tad nebija Valsts Darba inspekcijas, bet NVA tas projekts bija, jā, bet Valsts Darba inspekcija aktīvi ļoti piedalījās, jā, un tajā brīdī, kad mazie un vidēji uzņēmumi sāka reģistrāciju, jā, tātad uzņēmumu reģistrā, jā, tad, attiecīgi, vai tas ir tāds, kā tajā laikā bija tāda grāmatiņa, kurā attiecīgi bija runāts par darba aizsardzību, bet varbūt, kad šos cilvēkus, kuri ir reģistrējušies, piemēram, 1 mēneša laikā, uztaisam tādu nelielu sanāksmīti, jo tajā brīdī viņiem jau svarīgi, ja viņi būtu pieregistrēti, jā, uztaisam tādu nelielu sanāksmīti, jā, lai esam trietā, jā, 3, varbūt vairāk cilvēki, jā, trietā un pastāstam par šo labo praksi, kāda tad ir. Jo, teiksim tā, tad, kad es redzu, piemēram, šos nelaimes gadījumus darbā un runāju cietušo, tad, attiecīgi, kā teikt, parādās tāda situācija, kā daži, kā teikt, šo mazo uzņēmumu darba devēji it kā neko nav zinājuši. Es zinu arī ļoti labus piemērus, jā, kad attiecīgi tas darbojās un tā, bet šajā gadījumā mums ir ļoti svarīgi, lai mēs varētu tikt šajā uzņēmumā, jā, Un šajā uzņēmumā tika kāpēc? Tāpēc, ka arotbiedrība jau nav visur, kā teikt, ar atpūstām rokām gaida. Ja? Un ja šajā uzņēmumā mēs tiekam, tad viens no galvenajiem jautājumiem, lai piedot mani kolēģi, ja, bet man patiktos, ka mēs runātu tomēr par darba aizsardzību, ja, un tieši par risku izvērtēšanu, kā teikt, šī visa, teiksim, risku izvērtēšanas sistēma darbojas. Mēs esam izvērtējuši risku, kas tad ir tālāk, ja, vai tie ir individuālie vai kolektīvi aizsardzības līdzekļi, vai tās ir obligātās veselības pārbaudas. Un tādā veidā to varētu darīt. Un plus vēl, teiksim, tas labais pienesums, ko mums nes, piemēram, misija nulles, tā, teiksim, visa šī kustība, jā. Tātad, reizēm jau noteikti arī mazie uzņēmumi, kā teikt, paskatās visus šos labos piemērus, un šajos labos piemēros ir arī par to, kādā veidā darbinieki piedalās, jā, un ja piepaši nav labas, piemēram, kaut kādas, teiksim, spēcīgas arotbiedrības, tādi ļoti daudz darba devēji ir nolēmuši, ka viņi, kā teikt, paši inicijē šo jautājumu par darbinieku pārstāvjiem vai par uzticības personām, un viņi tiek iesaistīti, jo šajā gadījumā es uzskatu, ka viņi ļoti labi sapratuši to ideju. Jā, viens, kā teikt, teiksim, Renārs, piemēram, uzpasēs mātiņu, ja viņam, kā teikt, pienāks āja un teiks, jā, davai mēs, kā teikt, divatā to darīsim, jā, jo viņš, kā teikt, nav pieredzējis šajā jomā, no tā mēs tikai iegūsim visu kopā.
Jā, paldies, Mārtiņa. Piemetot savas 5 kapeikas par darbinieku iesaisti, es atceros tos senos laikus, kad arī es vērtēju darba vides riskus uzņēmumos, un man liekas, ka saruna ar darbinieku iedeva pusi no preventīvajiem pasākumiem, ko ieteikt, jo darba aizsardzības speciālists pats viennozīmīgi nevar izdomāt visu, kas ir jādara, un kur vēl labāk, ja darbinieks pasaka, kas ir tieši, kas viņam traucē, kas ir jāuzlabo. Un šī ir tāda viena puse, tā sena mūžsena jautājuma, par ko mēs runājam jau gadiem, kvalitatīva darbiniekus iesaistoša darba vides riska novērtēšana, bet tai pašā laikā mums apkārt mainās arī darba vide. Ja mēs, piemēram, arī skatoties uz ESENER datiem, nebija mums jautājumi par digitalizāciju 2014. gadā, jo digitalizācija, tur kaut kādi varbūt aizmetņi bija atnākuši līdz mums, bet šobrīd nav. Un mēs arī šobrīd runājam, kad runājam, teiksim, par sekām darba vidē, mēs nerunājam tikai un vienīgi par nelaimes gadījumiem vai par arodslimībām, bet mēs arī runājam par daudz tādām šaurākām un smalkākām tēmām, kā piemēram līdzsvaru vai robežu starp privāto dzīvi un darba dzīvi, un tā viennozīmīgi kļūst šaurāka, jo mans, laikam, piemērs, ko es parasti izmantoju, ir tad, kad tu aizej mājās un cep kotletes, vai tu domā par darbu vai nedomā par darbu, vai tas ir darbs, vai tas nav darbs, tas kļūst ar grūtāk nošķirams, un man gribētos jums abiem uzdot jautājumu par to, kā jūs redzat, vai digitalizācija tas ir iespēja uzlabot darba apstākļus, vai tie ir jauni riski, un kā panākt, lai darba vide kļūst labāka, izmantojot digitalizāciju, vai redzat savu kā sociālo partneru lomu tieši šajā digitalizācijas aspektā darba vidē? Aija, lūdzu.
Par digitalizāciju. Digitalizācijai nevajadzētu būt tikai digitalizācijas pēc. Ja tas ir biznesā pamatota nepieciešamība, lai mēs varētu darbu izdarīt ātrāk, efektīvāk vai tā kā biznesam dot to ieguldījumu, tad tas ir pamatoti, bet šāda veida procesa ieviešanā, kas būtu pats svarīgākais, kas es pieļauju, ka šobrīd nevienmēr visās darba vietās notiek, kad pirms šī digitalizācijas projekta ieviešanas mēs vispirms izvērtējam šos iespējamos riskus un ieguvumus. tas nav, man liekas, neko daudz atšķirīgi arī tad, ja mēs veidojam jaunas biroja telpas darbiniekiem, tad nevienmēr dizains iet roku rokā ar darba aizsardzību, jo tas, kas citreiz ir skaisti, nevienmēr ir droši. Tāpat tās arī digitalizācijā, ja mēs no biznesa viedokļa tur redzam, kad šis process uzlabos, piemēram, produktu izgatavošanas termiņu, tad iespējams tas process radīs jaunus riskus darbiniekiem. Tā kā mans skatījums ir tas, ka pirmām kārtām, ka digitalizācija nevajag tikai digitalizācijas pēc, tāpēc, ka tas ir moderni un labi skan. Tas ir vajadzīgs tikai tad, ja tās biznesam dod pievienoto vērtību un vienmēr vispirms izvērtēt tā kā jau iespējamās sekas šai procesā, kas varētu rasties attiecībā uz darbinieku drošību.
Paldies, Aija. Mārtiņ?
Tātad digitalizācija, jā, man ļoti patīk digitalizācija un ieiešana visās, kā teikt, šajās tehnoloģijās un tam līdzīgi, jā. Bet atcerēsimies vienu, kā cilvēki ļoti dažādi to visu uztver, jā, un ļoti bieži cilvēki, kuriem nav pietiekamas, kā teikt, tādas izglītības vai pietiekamas, kā teikt, kompetences, jā, viņš to uztver kā iespēju, ka viņš var pazaudēt šo, kā teikt, darbiņu, jā. Tas ir tas, kas varbūt tā virspusēji liekas tā būtiski, bet Latvijā man jāsaka tā, kad ir cilvēki, kuri ir ļoti zināt griboši, jā, un es esmu vairākās vietās Latvijā, piemēram, bijis bibliotēkās, kur cilvēki apgūst, tā skaitā arī jau pensionāri apgūst šos datortehnikas pamatus, jā. Tātad, lai attiecīgi, teiksim, jau pirmajā solī varētu, kā teikt, jau darboties ar kaut kādām digitalizācijas lietām. Jā, man nav bijis iespēja daudzos būt metāla apstrādes uzņēmumos, jā, bet jā, teiksim, tādos 4 uzņēmumos, kuros es esmu bijis, es esmu vienmēr redzējis, ka, piemēram, metāla plāksnes tagad jau griež tikai un vienīgā lāzera un ar datoru palīdzību, jā. Tātad neviens tur nestaigā ar, kā teikt, krīta gabaliņu un nestāsta, kādā veidā tas notiek. Tā ir tā, ko Aija teica, nepieciešamība pēc digitalizācijas. Ja mums ir tāda tehnoloģija, kuru mēs varam izmantot, jā, tad mēs viņu noteikti izmantosim. Ja mēs stāvēsim pretī tai tehnoloģijai, jā, tad būs tā kā savā laikā par Fordu, kā teikt, riteņiem teica, ka mašīnā, ko montēja uz konveira, tad tur darbinieki bāz iekšā tos sprunguļus riteņos, jā, lai viņi, kā teikt, normāli neiet, jā. Jo tas ir pirmais, kas cilvēki vienmēr, kā teikt, aizstāv. Man patīk relatīvi sakarīgi tad, kad mēs, piemēram, darba aizsardzībā digitalizāciju izmantojam, piemēram, šajās apmācībās un tam līdzīgi, jā. Bet man, piemēram, liekas, ka reizēm tas aiziet bišķiņ maliņā, jā. Jo, ja man, piemēram, ir darba vietā kaut kur, teiksim tā, 20 instrukcijas, kas cilvēkam ir jāzina, ja, un viņam šī darba vietas, kā teikt, pārbaudījums ir 5 jautājumi, ja, tas nav nopietni, ja, tātad mēs vienkārši kāsīt ievilkam, ka tāda lieta ir izdarīta, ja, bet īstenībā darbinieka šīs zināšanas nav pārbaudītas. Man bija tas lielais gods sākt šo, tajā laikā tas nesaucās digitalizācijas process, jā, bet vienā lielā uzņēmumā, kas nodarbojas ar telekomunikācijām, mēs bijām uztaisījuši tādu elektronisko atskaišu, kā teikt, iesniegšanas sistēmu vai darba aizsardzības interešu, kā teikt, pārbaudas sistēmu, zināšanu pārbaudas sistēmu. Un, tā kā tas bija ļoti atkarīgs no tā arī darba samaksas cilvēku, un viņi centās vienmēr šo, kā teikt, visu iziet, apmācīties, jā, un tad dators vēl varbūt nebija, kā teikt, viss nebija uz stūbu, bet bija uz jūs, bet visu to centās izmācīties un tam līdzīgi. Es domāju, ka digitalizācija mums ir liela, kā teikt, cerība, un kolēģi tie, kas, jā, visu laikam arī ir bijusi profos, jā, jūs redzat, kā arī šie jaunie cilvēki jau, teiksim, viņi pat nemaz, kā teikt, nekautrējās teikt, ka viņi ir izmantojuši šo, kā teikt, mākslīgo intelektu kādu uzdevumu risināšanai, jā. Piemēram, mans kolēģis Kaspars ļoti nopriecājies, ka attiecīgi tās te karikatūras zīmē un tam līdzīgi, jā. Tas ir normāli, jā, jā.
Paldies, Mārtiņ, paldies, Aija. Mums vairs nav jautājumu sociālajiem partneriem no klausītājiem, tāpēc paldies jums par atbildēm uz jautājumiem. Un es lūkšu tagad Renāram atbildēt uz jautājumiem, kas saistīti ar Valsts darba inspekcijas darbu. Mans jautājums ir šāds. ESENER dati mums parāda, ka Latvijā darba inspekcija ir apmeklējusi mazāk uzņēmumus nekā mūsu kaimiņu valstīs. Tā ir aptuveni 1/3 daļa Latvijā. Un vai tev ir kāds skaidrojums, kāpēc tā situācija varētu būt šāda? Un kā var būt, vai tā ir atšķirība pašu darbu inspekciju darbā, nezinu, uzņēmumu atlasē, vai kādi varbūt citi skaidrojumi? Lūdzu, Renāra.
Jā, paldies, Linda. Es droši vien sākšu to, ka varbūt nav tik svarīgi salīdzināt sevi tieši ar kaimiņu valstīm no tāda pārbaužu apjoma viedokļu. Es godīgi biju pat pārsteigts, kad mēs tik daudz esam bijuši šajos aptaujātajos uzņēmumos, jo vairāk kā 1/3 tas arī, man liekas, neaptver tādu kopējo bildi valstī, jo īpaši mēs runājam par kādiem maziem mikrouzņēmumiem, mēs noteikti nespējam aiziet pie viņiem pietiekoši regulāri, un tas apjoms noteikti ir stipri mazāks. Nenoliedzami kopējais darba inspekcijas pārbaužu skaits ir samazinājies pa gadiem, tāpēc tas man tā ļoti nepārsteidz, ka tā tendence ir, ka mēs iepriekš bijām atzīmēti, ka esam bijuši gandrīz pusē no intervētiem uzņēmumiem pēdējo 3 gadu laikā, un jaunie dati rāda, ka mēs esam bijuši drusciņi vairāk kā 3. daļā no aptaujātiem uzņēmumiem pēdējo 3 gadu laikā. Tā kā tā tendence, kad pārbaudas kopumā tiek veiktas mazākas, viņa ir. Es domāju, ka arī gaidīt, ka tā bilde mainīsies uz priekšu, visticamāk nav, jo resursus neviens klāt iestādēm neliek pārbaužu apjomu palielināšanai. Un tāpēc tam fokusam, ja mēs runājam par tādu Latvijas specifiku, tam fokusam viennozīmīgi ir, un viņš būs arī uz priekšu, ka mēs ejam mērķēti uz tiem uzņēmumiem vairāk, kur ir tā lielākā bīstība. Nevis mēģinam noklāt kaut kādu vidējo procentu un aiziet pie katra reizi 10 gados, bet ejam tiešām uz tiem uzņēmumiem, kur tie riski tiešām ir aktuālāki un būtiskāk. Ejam pēc šī preventīvā principa. Un tas droši vien tas, uz ko mēs arī turpmākajos gados turpināsim fokusēties.
Un tas, ka Valsts darba inspekcijai ir ļoti daudz tie jautājumi, ko viņa uzrauga un kontrolē, ne tikai darba aizsardzībā, pat ja mēs skatāmies tikai darba aizsardzībā, tā amplitūda ir no letālo nelaimes gadījumu izmeklēšanas, izdegšanas sindroma, riska novērtējumiem un dažādiem citiem jautājumiem. Kā praksē izdodas sabalansēt to, vai tā ir darba aizsardzība, vai tas ir, kas ir tās prioritātes un kas būs tās jomas, ko mēs redzam nākotnē, kuram darba inspekcija, tuvāko 5 gadu laikā varbūt pievērsīs primāru uzmanību?
Tu jau labi zinot uzskaitīji, tās milzīgās amplitūdas, kas ir vienā darba aizsardzības jomā vien. Neaizmirsīsim, ka Latvijas gadījumā darba inspekcija arī sēdz darba tiesību bloku, tā kā arī tās prioritātes nekur nepazūd, kā nereģistrētā nodarbinātība, darbinieku nosūtīšana, kas ir ar milzīgām pieaugušām tendencēm, es domāju, viestrādnieku ieplūšana Latvijā. Tā kā šīs prioritātes nekur nepazūd no mūsu dienas kārtības, un arī tām ir zinām ietekme arī uz darba aizsardzību. Skaidrs, ka darbspēks, kas nav no Latvijas, kas nāk šeit iekšā ar savām tradīcijām, kultūrām, izpratnēm, viņš ir arī papildus tāds apgrūtinošs elements, ar ko ir jāstrādā, jo tās lietas, par kurām mēs varbūt līdz šim neesam tādā apjomā saskāršies, kā viņas nāk. Bet runājam par tām nākotnes risku lietām un prioritātēm. Es domāju, tu jau šīs prezentācijas un vispār diskusijas sākumā arī uzdodot jautājumus Javieram, iezīmē vienu to būtisko Latvijas bildi, proti, ka šie smagie letālie nelaimes gadījumi, pēc tiem rādītājiem mēs esam vieni no sliktākajiem Eiropas Savienībā, tā kā tā nevar nepazust no mūsu prioritāšu saraksta augšgala. Tieši darbs ar smagiem letāliem nelaimes gadījumiem, tā kā var teikt tie klasiskie riska elementi. Ja? Un kas varbūt šajā stāstā ir tas būtiskākais, ja? ko varbūt mēs neaptveram šajā diskusijā, ka tā piramīda nelaimes gadījumi, ja mēs skatāmies viņu uz leju un runājam par tiem saucamiem nesmagajiem nelaimes gadījumiem, kas netiek atzīti kā smagi, bet klasificējās kā nesmagi, tad tā piramīda ir faktiski izkropļota, un es domāju, nav noslēpums nevienam klātsošiem, kas piedalās diskusijā, gan arī droši vien skatās šo raidījumu un ierakstu, kad Latvijā mēs joprojām neredzam to objektīvo pilno bildi ar to, kāda ir situācija nelaimes gadījuma darbā. Un tā ir drusciņ tāda strausa politika, ja uzņēmumi un darbinieki iet ceļu, ka mēs slēpjam vai neziņojam un attiecīgi neizmeklējam šos nelaimes gadījumus, kas nav smagi. Tas ir tikai laika jautājums, kad notiks atkārtot šie nelaimes gadījumi, un tas ir tikai laika jautājums, ka šie nelaimes gadījumi būs ar smagākām sekām un beigās varbūt ir pat ar letālām. Un, protams, ļoti sāpīgi un tas sliktākais tajā, kad cieši gan darbinieks, jo nav iespējas, saņemt šos valsts kompensācijas mehānismus, ārstēšanās izdevumus, rehabilitācijas izdevumus. Bet pats drūmākais tajā visā stāstā ir, ka uzņēmums neizdara secinājumus, tad mēs neizmeklējam negadījumu, nesaprotam, kāpēc viņš notika, kādi bija šie cēloņi, un tas ļoti būtiski apgrūtina mainīt bildi pašā uzņēmumā, mainīt šo kultūru, tad tā kultūra ar to, ka mēs par riskiem neesam informēti un ka nelaimes gadījumiem ir ļoti liela iespēja atkārtoties vai notikt ar smagākām sekām, ir liela. Protams, tas ietekmē arī šo valsts situāciju un arī mūsu apgrūtina, ja mēs nezinām, kuros uzņēmumos, kādās nozarēs, kādi riski, kādi negadījumi varētu potenciāli būt tie, uz kuriem mums būtu jāfokusēs. Arī mums, protams, no valsts kā viedokļa grūtāk šo jautājumu preventīvi risināt. Tāpēc tā, es teiktu, tādu milzīgu prioritāti, ko mēs liekam savā arī nākamā perioda stratēģijā, kā vienu no tādām milzīgām aktualitātēm, uz ko strādāt. Ja runājam par tādiem jauniem nākotnes riskiem, tad, protams, nenoliedzami nekur nepazudīs šīs muskuļu skeleta sistēmas līmes, kas ir šodienas aktualitāte, ko, man liekas, arī pētījuma dati radīja, ka tā ir šobrīd arī atzīmētā uzņēmuma viena no aktuālām lietām, un noteikti nekur nepazudīs un tikai pieaugs visi jautājumi, kas saistās ar psihoemocionāliem, mentālās veselības riskiem. Tā kā tie viennozīmīgi ir nākotnes prioritāšu sarakstā, jā, un tas ir tas, uz ko mums būtu noteikti jāskatās.
Paldies, Renār! Mēs neesam no klausītājiem saņēmuši vairāk jautājumus, tāpēc mēs ļoti ātri, straujiem soļiem tuvojamies semināra nobeigumam. Un nobeigumā es katram no dalībniekiem, diskusijas dalībniekiem lūgšu vienu ziņu, vienu vēlējumu, vienu vēstījumu, ko paņemt no šīs diskusijas līdz. Un sāksim ar Renāru. Renāru, lūdzu.
Jā, es, kad skatījos prezentāciju, domāju, kuru no visām lietām, lai pasaka kā to vienu, kas man ir tā mana atziņa vai mans mājas darbs vai vēstījums, ko varētu pateikt. Protams, ka tur bija daudz lietas, kā jau to arī pateicu, daudz lietas, kas arī varbūt bija drusciņi pārsteidzoši, arī tādā patīkam pozitīvā ziņā. Bet, ja man jāizvēlās viena, tas laikam izvēlšos to, kas attiecās uz mums, kur mēs varam kaut ko kā arī kā darba inspekcija dot savu pievienoto vērtību un darīt. Un tas, man liekas, ir tieši šis moments par psihoemocionāliem riskiem, kur rāda, ka Latvijā mēs atpaliekam šajā izpratnē, jā, tā kā un liekot kopā ar to bildi, ka tā tendence tikai un viennozīmīgi ies uz augšu, ka mēs jau šobrīd jūtam un redzam, ka arī pie mums nāk iekšā arvien vairāk un vairāk šis ziņas signāli, darbinieki sāk par to runāt arvien vairāk, kad mums ir šeit jāinvestējās un jāveicina šī darba devēja, darbinieku izpratne un viennozīmīgi, ko arī Maks Kavņers pateica, darbinieku iesaist šajā tēmā, jo bez tās mēs nekur noteikti ar risinājumiem netiksim tālu.
Renāra, Aija, lūdzu.
Man līdzīgi kā Renāram ir vairākas lietas, un es atļaušos arī minēt divas, jo viena lieta ir tā, ko es paņemšu tā kā priekš sevis, kā uzņēmuma pārstāve. Man ļoti interesēja šīs Portugāles vērtējums, kur viņi saka, ka viņiem ir ļoti daudz tieši šie ārējie pieprasījumi sakārtot darba aizsardzības sistēmu, gribu redzēt, kā tas tiek organizēts un mazliet to pastudēt. Bet otra lieta, kas ļoti tādā bēdīgā varbūt skatījumā ietekmēja par šo mazo darbinieku, zemo darbinieku iesaisti darba aizsardzības sistēmas izveidē šie uzticības personas, arotbiedrības. Man šķiet, ka ir ļoti būtiski, kad katrs darbinieks pats novērtē savas dzīvības un veselības vērtību un ir gatavs tā kā ar darba devēju runāt un iesaistīties šo jautājumu risinājumā ļoti, ļoti svarīgi, jo es domāju, ka arī daudzi lielākā mērogā uzņēmumi saskarās ar to, kad bieži vien no darbiniekiem šīs idejas par darba vidas uzlabojumiem ir vienkārši jāizvelk ar kādām metodēm, ar atbalstiem, ar piedāvājot dažādas atbalsta pasākumus, lai tikai tiktu iesniegti šie priekšlikumi. Līdz ar to es novēlētu, ka mums Latvijā tieši no šī darbinieku darba drošības kultūra uzlabotos un katrs darbinieks novērtētu pats savu dzīvību un veselību, cik tā ir svarīga.
Paldies, Aija. Mārtiņ?
Man palika arī kaut ko pateikt, jā, tātad no savas puses, tā kā mums ir tepat aiz stūra mēnesis novembris, kas ir mūsu valsts mēnesis, jā, tad es gribu es uzrakstīju tā, mēs esam uzcēluši savu valsti, un šajā valstī esam izveidojuši darba aizsardzības sistēmu. Un viens no darba aizsardzības sistēmas pamatelementiem ir konsultēšanās, jā. Un šo konsultēšanos var sasniegt tā, kā Aija saka, ka katrs darbinieks attiecīgi, kā teikt, izvērtē savu darbību un tam līdzīgi. Bet man ļoti gribētos, lai mēs radītu arī šo uzticības personu spēcīgu, kā teikt, tādu draudzi, jā, kas attiecīgi, kā teikt, darbojās, jā, palīdz šiem darbiniekiem, jā, jo darbinieks jau īstenībā jau nav darba aizsardzības speciālitāte ļoti plaša, bet viņš ir tas, kurš zina šīs visas lietas, jā, un līdz ar to man ļoti gribētos, lai šeit parādītos šī skaistā lieta, ko mēs saucam par darbinieku pārstāvniecību, jā, un kvalitatīvu darbinieku pārstāvniecību. Vienkārši, ja mēs ievēlējam cilvēku kāsīšu labu, tas nav tas, ko mēs, kā teikt, gribam. Mēs gribam, lai viņš darbojās un attiecīgi, kā teikt, arī sasniedz šo rezultātu. Un var jau būt kaut kur, ja sistēma sāks normāli darboties, jā, ar šiem darbinieku pārstāvjiem, jā, tad ir iespējams, ka vismaz 1 vai 2 gadījumi nelaimes aiziet projām, jā, un tas ir ļoti liels sasniegums.
Paldies, Mārtiņ. And the last words for Kshabi, please.
Well, thanks very much for the event today. And from my part, as one takeaway message, maybe I would like to highlight the importance of musculoskeletal disorders, how they are the most frequently reported risk factors in Latvia, and not only in general, but also when linked to digitalization. Digitalization, we saw, it's also more frequently reported in Latvia than in the rest of the EU27. And interestingly, there seems to be an increased awareness of the potential impact of digitalization on health and safety at work. And finally, I also wanted to make a point about worker participation and representation, which seems to be less frequently reported in Latvia than in the rest of the EU27. Thank you very much.
Paldies visiem, paldies lektoram, paldies diskusijas dalībniekiem un nobeigumā varbūt viens vēstījums vai viens, ko paņemt līdzi no manas puses ir, man bija tiešām liels prieks dzirdēt, ka visas puses atbalsta to, ka vairāk ir jārunā ar darbiniekiem. Varbūt nevajag gaidīt oficiāli ievēlētu personu, oficiāli nodibinātu arotbiedrību šūniņu. Ja esiet darba aizsardzības speciālists, ejiet pie darbiniekiem, runājiet ar darbiniekiem, prasiet, ko uzlabot. Viņi ļoti bieži pateiks, kas ir tas, kas viņiem traucē, un jums būs viegli izdomāt kopā kādus pasākumus īstenot. Tāpēc tas būtu tas, ko paņemt līdzi katram darba aizsardzības speciālistam, un paldies dalībniekiem par dalību. Tie, kas klausījās un vēlas saņemt semināru par šī webināra noklausīšanos, tad es gaidīšu jūsu ēpastus uz adresi linda.matisāne@vdi.gov.lv, un es šī semināra apliecinājumus jums nosūtīšu atbildot uz ēpastu. Paldies jums visiem un uz tikšanos citā reizē!